This election will come down to the clearest, starkest choice in this province's history. It will. We can go forward with the agenda that I've outlined, or we can go backward with Doug Ford. It's a choice between care or cuts.
On April 1st, Ontario's 29,000 physicians entered our 5th year without a contract. This is unprecedented not only here in Ontario, but in all of Canada. Today, we are amidst the worst healthcare crisis Ontario has ever seen. This did not happen overnight. It is the result of years of complete and utter neglect and gross mismanagement of our once precious healthcare system by Premier Kathleen Wynne and the Liberal government. Ontario's doctors have endured and continue to endure 7 consecutive years of deep cuts to the essential frontline patient care that we provide. Just months after winning the last 2014 election, Wynne's government stopped negotiations with Ontario's physicians and instead decided to unilaterally cut physicians' patient services. Since January 2015 alone, this has amounted to more than $4 billion in reckless unilateral cuts to the patient services that Ontario's doctors provide to 14 million Ontarians.
It's a choice between care or cuts.
These cuts are still ongoing today and are averaging approximately $100 million a month. With sweeping cuts across the board and deletion of entire fee codes in the face of rising inflation and growing overhead expenses, Ontario's physicians have seen a net decrease of 30% in physician compensation since 2012. This ranges from 30% for family physicians to an upwards of a decline of 40 to 60% for specialists. The recently announced federal taxation changes and Wynne's proposed tax changes will only add to this burden and will make it harder for physicians to keep their clinics open. The deep cuts to frontline care have already forced many physicians to retire earlier than planned, and even more to close their clinics and leave the province entirely, impacting the direct access and care of over 250,000 patients.
We can go forward with the agenda that I've outlined, or we can go backward with Doug Ford.
There are now 1 million patients in the province without a family doctor, and some specialist wait times have exploded to more than 3 years. Ontario is notable for having fewer doctors and hospital beds per capita compared to all other countries in the world, and Canada consistently ranks last or near the bottom for accessibility to patient care amongst the wealthiest nations. Patients must realize that the only reason wait lists exist is because Wynne's government chooses to ration patient care in order to pay the $1 billion in monthly interest in our province's nearly $350 billion debt, the largest debt of any sub-sovereign jurisdiction in the entire world, accumulated from years of waste, scandal, and mismanagement.
This election will come down to the clearest, starkest choice in this province's history.
However, Wynne's government has continued to find millions and millions of scarce tax dollars to ensure Ontario remains a world leader in healthcare bureaucracy. The wasteful spending in our healthcare system is concentrated amongst the hospital executives and CEOs, the LHINs and the sub-regional LHINs, and its allied bureaucracies. These are the only parts of our healthcare system that have consistently seen increases in funding and growth over the last decade. Ontario's Auditor General reports have consistently damned these LHINs for their wasteful spending and have indicated that they have never shown their worth despite taking almost $90 million of taxpayer dollars every year.
It's a choice between care or cuts.
The Auditor General has indicated that the Minister of Health fails to hold these LHINs to account, while the LHINs themselves fail to meet their mandate. The province's fiscal watchdog, the Financial Accountability Officer, recently sounded the alarm, indicating that the frontline funding is grossly inadequate to meet the needs of an aging and growing population. Of course, the Liberal government's solution has been to cut billions of dollars more from the frontline patient care while wasting millions more in the expansion of wasteful healthcare bureaucracy, increasing our 14 LHINs with an additional 90 new sub-regional LHINs, each with their own board, CEO, and staff. Frontline physicians have been voiceless against all of this. Our government has attacked and has vilified frontline physicians, while our legal representative, the Ontario Medical Association, has failed to represent the interests of physicians and has been passive as 5 pieces of detrimental healthcare legislation have passed in just the past 2 years.
We can go forward with the agenda that I've outlined, or we can go backward with Doug Ford. It's a choice between care or cuts.
These promises will not solve our healthcare crisis. This government has proven that it cannot be trusted. Healthcare is not a political game. Ontario's frontline physicians will not be silenced as the government impacts our patients' lives.